Welcome to the Nobel Prize for Social Innovation and Impact. We would like to introduce ourselves, Christina Huff, Annie Baxter and Sophie Roden, the judges for this prestigious award. The shortlist this year is made up of 5 organisations that have all made a significant impact in addressing social needs. The panel decided to split the assessment of organisations across the group to enable comprehensive assessment of each organisation. Assessment was based on 3 criteria, and the panel added another criteria, the organisation's impact on systems change. We wanted to ensure that when judging, our scoring method was calibrated against a standardised model. This resulted in clear definitions as shown in this example, meaning we were able to achieve consensus moderation by specifying how quality was defined across each selection criteria.
When considering unmet need, we worked together to develop measurable definitions. For example, a significant unmet need was defined as incredibly significant to a small number of people or moderately significant to a large number of people. We considered evidence of the unmet need, evidence of the need for it to be addressed, and evidence that the organisation met the need appropriately. Unmet need was weighted at 20%, which is less than the impact in systems change sections. This was done because the group felt that, while the gravity of unmet need is important, it is not as important as whether an organisation makes an impact on this need or achieves systems change. Section 2 of our model focused on the organisation's capacity for growth. We again developed a detailed definition of each of the sub-criteria. For example, the ability to be sustainable was defined more succinctly as the ability to be sustainable in the next 10 to 15 years, and the model will hold up to changes in market conditions. For each of the sub-criteria, each organisation was given a score from 1 to 10. Scores between 0 and 3 reflected a limited ability to meet the criteria, 4 to 7 reflected a moderate ability, whilst 8 to 10 reflected an extensive ability to meet the criteria. This criteria was weighted at 20%, which, again, is less than the impact and systems change sections. This was done because the group felt that the relevance of an organisation's ability to scale is to some extent dependent on whether it is achieving impact or systems change at its original level. Section 3 of the Boronia model focused on the organisation's ability to achieve impact. Given the breadth of the organisations assessed, and that the team was restricted to publicly available information on each organisation, impact was measured by the development of unique indicators for each organisation. For each, 2 to 3 indicators were developed by the panel. Each of these indicators was then assessed against the model descriptors and an overall score given for the long term and the short term. As previously mentioned, impact scores were weighted at 30% as one of the 2 most important measurements. Finally, the panel chose to measure the organisation's ability to deliver systems change in relation to the unmet need, and clear definitions were developed. A limited impact was one that had not changed the broader system in a significant way and not addressed the root cause, while an extensive impact resulted in the development of a new system addressing the unmet need at its root cause. Systems change was weighted at 30%.
The first organisation in the shortlist was Kiva, the microfinance organisation set up in 2005 to connect people through lending to alleviate poverty. Kiva ensures that 100% of funds lent go to loans and support the majority of operations through lender donations. Although microfinance was already well established from the work of Mohammed Yunus, Kiva put microfinance on the map. Although Kiva does not charge interest, Kiva uses field partners who do. Kiva has begun rating their field partners by social performance to encourage responsible lending and responsible management of loans. In 2005, the unmet worldwide demand for microfinance was extensive, estimated in the hundreds of millions. Kiva has contributed to addressing that unmet need, but only on a small scale, having serviced 2.5 million people. In terms of capacity for growth, many argue that Kiva is not a scalable model. In terms of impact against the 3 indicators identified for Kiva by the panel, Kiva has not evidenced an impact on poverty reduction, reduced the gap between supply and demand significantly, or attempted to address the underlying social relations that cause poverty. It is generally agreed that microcredit is not a magic bullet for poverty alleviation, and so for this reason it cannot be said that Kiva has contributed to systems change. Kiva scored a total of 44.3% effectiveness against our model.
The next organisation is Médecins Sans Frontières. This is one of the world's most high-profile charities, having been around for 40+ years, and they have millions of individual donors around the world. They have a huge staff on the ground providing humanitarian medicine in war zones, after natural disasters, and during epidemics. The millions of individual donors is quite significant because it allows MSF to be an independent and neutral organisation. This is critical because they have an important advocacy role as well as on-the-ground assistance. They think that bearing witness to what they see is as important as providing healthcare. In terms of unmet need, both the numbers of people affected and the urgency of the situations are immense. It's estimated that around the world up to 2 billion people might be living in situations of violence and conflict, and natural disasters and epidemics affect millions more. In terms of capacity for growth, MSF has grown into a very large organisation in 40 plus years, coordinating tens of thousands of staff and volunteers. However, it's a very labour-intensive, expensive and high-touch model, so it's difficult to see how it could scale further. Impact for MSF is very great in the short term. In many cases, such as the current Syrian conflict, they are providing healthcare that simply otherwise would not be provided. It's harder to quantify the impact of their advocacy work, which speaks out against some of the conflict and issues that they tackle in the course of their work. This is likely to be worth millions in PR, but again, tough to formally quantify. It was harder to see where MSF were making a big impact in terms of systems change. While they'd made a few cursory efforts to team up with other players in preventative medicine and disease control, this is certainly not at the heart of what they do and doesn't seem to be a priority. Overall, MSF is a bold, brave, courageous organisation who rightly has a very high profile. However, it was extraordinarily hard in assessing them to get a handle on their true impact, given they primarily report activities rather than impact. Further, their reliance on individual donors means they are potentially very vulnerable to future economic shocks, as these donations would be the first thing to go in the case of a recession. Overall, MSF's gained a score of 62 in our model, a very strong performer, but not one that has a modern and progressive approach in the world of social impact. Creative Commons is quite a different kind of organisation. Founded in 2001, they exist to help the true potential of the internet to be realised, unlocking growth, development and productivity. They were formed after recognising that the existing copyright framework was not a fit for purpose in the internet age and could actually have a chilling effect on participation in cultural life on the internet. Creative Commons created 6 simple licenses that people could apply to their works in order for them to be reused and used, and today 1.2 billion Creative Commons works exist. Creative Commons was a difficult organisation to assess because so much of their impact is likely to be felt in future and hasn't necessarily been achieved yet. It's also very difficult to adequately quantify the impact of their work because it's hard to calculate the impact of someone being able to access information for free when they would have had to pay or wouldn't have been able to use it at all. However, suffice to say, in the areas of education, healthcare, scientific research and government, there could be immense world-changing benefits of information existing in the public commons rather than it being locked away for private use. In terms of systems change, what Creative Commons has achieved is nothing short of an entire upending of the copyright system. No mean feat. So while it was tough again to ascertain formal impact measures, the potential upside of Creative Commons was extremely exciting to this judging panel. They have a weightless online model which is extremely scalable, they showed boldness to upend an entire copyright system, and the upside of making huge swathes of human knowledge available to all is extremely exciting. They received a score of 73 against our model.
The third organisation on the shortlist is BRAC, a large international NGO founded in Bangladesh. BRAC employs private sector ideas including social enterprises and a microcredit scheme. BRAC's programs and social enterprises tend to look at a problem holistically, and interventions are developed all along the value chain to ensure the problem is addressed in a comprehensive manner. Its programs and social enterprises tend to look at a problem holistically, and interventions are developed all along the value chain to ensure the problem is addressed in a comprehensive manner. BRAC is attempting to address a very important unmet need, global poverty. As an organisation, it has scaled significantly and most recently has scaled internationally. To measure BRAC impact, 3 key indicators were identified, all of which represent poverty reduction in Bangladesh. And although not all indicators have met the target set, they have all improved substantially since 2010 and are on their way to being met. Now, in terms of achieving systems change, BRAC has attempted to do this by demonstrating that an organisation doesn't need to be donor-dependent to address global poverty. BRAC has a total score of 76% effectiveness against our model. The fourth organisation on the shortlist is the Open University. It It was founded in 1969 with the aim of making higher education available to anyone who sought it. It tried to achieve this by adopting a model of low course fees, limited entry requirements, and flexible learning patterns, including distance learning. Access to higher education is an unmet need for a proportion of society. In terms of capacity for growth, the Open University's current scalability is questionable, given that over the past 5 years it has contracted both in terms of number of students and annual revenue. And although the model originally pioneered systems change in the higher education sector, in recent years it has failed to adapt to changes in the broader education context. The Open University scored a total of 39% effectiveness against our model. BRAC was selected as the winner as it scored the highest results. The key reasons BRAC was successful include the significance of the unmet need, the financial sustainability of the model, and the demonstrated impact it has achieved. Through the work of BRAC, poverty in Bangladesh has decreased to 18.5% in 2010.